But we do have these new treatments that are available today. And I think it's important to share with the endocrinologist. We have we actually have 4 different drugs that we can talk about. We have anti-VEGF drugs that are available, and there are 3 of those that we can talk about. One is not commercially available in the form of Eylea or aflibercept, so we're limited to the discussion of bevacizumab or Avastin and Lucentis or ranibizumab. And steroids. We have different steroids that are available. These drugs have been used. We have a randomized clinical trial in the RIDE and RISE trial that has totally changed how we treat our patients. You know, and prior, when I started and we talked about it, laser treatment was a treatment of choice. It was the gold standard. And it gave us 3 to maybe up to 15% 3-line gainers, but closer to 3 usually. And it halved the amount of visual loss. Now, why don't we bring the endocrinologists up to date, you know, the 30 to 40% 3-line improvement we're seeing and how you incorporated this, because before we only had destructive means of treating these patients.
So how many drugs now you have available?
We have on label for the treatment of diabetic retinopathy, there are 2. There's one drug called Macugen, which has largely faded away because it's a very specific targeting one isoform and it's considered sort of not as potent. That's the aptamer. Then we have the antibody technology. We have a fragment from Genentech called Lucentis, which is an antibody fragment. It's one arm that binds the antigen, and it's extraordinarily powerful. And then there's a third drug that's in trials for DME called aflibercept for Regeneron, or Eylea. So there's really one drug that's on label and commonly used. It's called Lucentis. It's given by injection into the eyeball on a monthly basis, no more frequently than a month.